to Workplace Health Insights Live. If you've joined us before, you know the drill. If you're joining us for the first time, we created this series to discuss the healthcare challenges faced by UK businesses. This is all part of our commitment to keep you informed on the latest trends we're seeing within Bupa and across the wider healthcare market. Our role is to help you and your clients navigate the health and wellbeing landscape, so you always feel one step ahead when it comes to the healthcare challenges of your workforce. For today's main topic, we'll be addressing health inclusion in the workplace. The pandemic has highlighted some of the health and wider inequalities that persist across the globe and the need for change. As a society, we're more diverse than ever, we're more informed, and we're more aware and prouder of our individuality. As a result, we're seeing shifts in attitudes, behaviours, and expectations towards health and wellbeing. In many cases, healthcare has traditionally been designed around a one-size-fits-all approach instead of the unique needs of the individual. It's more apparent than ever that the healthcare industry has an opportunity, and more importantly, a responsibility to transform, recognising every person is unique, and so are the conditions, diseases, and healthcare challenges that we face. Being an inclusive employer is not only the right thing to do, it also makes business sense. We know varied teams make better decisions when they reflect the broad demographic of an organisation's customer base. Research released this week from Bupa's Global Executive Wellbeing Index reveals that 1 in 4 UK executives believe clear strategies around diversity and inclusion are crucial for employee wellbeing. The research also found that diversity improves financial performance, plus it's now central to talent attraction and retention strategies, with employees now expecting more from organisations to support their unique needs. Post-pandemic, we're seeing a sea change in behaviour. Businesses are striving to keep some of the wellbeing wins that the pandemic has prompted, like a general emphasis on mental health and better diversity and inclusion at work. Now businesses and healthcare partners want to reach a place where no matter what your sex, gender identity, age, cultural background, race, ethnicity, sexual orientation, disability, or socio-economic situation, you can easily access healthcare that is as unique as you are. When it comes to EDI, equity, diversity and inclusion within healthcare, all businesses are on a journey. It's an enormously complex issue and many people aren't sure where to begin. One thing I've taken away from speaking to members of the team here at Bupa is the importance of just getting started on the conversation. That means engaging in often unfamiliar topics of health and wellbeing that reflect the diversity of your organisation. Whether this is the menopause, mental health, or gender dysphoria, talking about these issues helps create a more open culture where people can talk about their needs and seek out the support available. At Bupa, we're passionate about putting EDI at the heart of what we do. Our ambition is to help our clients and our own people to bring their whole selves to work and be confident to seek out health and wellbeing support for their own individual needs. Like many organisations, we're on a journey, and we know there's always more we can do to support our customers' employees. But collectively, I believe we can improve the health and wellbeing of generations to come by creating an inclusive healthcare system that celebrates health for everybody. So I'm delighted that we're using today's session to have this important conversation, and we're joined by a fantastic panel of experts to discuss how businesses and their healthcare partners can deliver against the diverse needs of their workforces. So in terms of today's agenda, first up, we'll hear from Dr. Naveen Puri, Associate Clinical Director at Bupa Health Clinics. Naveen's going to spend 15 minutes or so sharing clinical insights that are likely to affect all members of your workforce, highlighting the importance of identifying these healthcare challenges through the lens of EDI, equity, diversity and inclusion. We'll then welcome Catherine Garrod, who founded Compelling Culture to help organisations get their approach to engagement, diversity and inclusion right. Previously, she led Sky as Head of Inclusion to be one of the most inclusive employers in the UK, with 80% of teams increasing diversity both on and off screen. We'll be quizzing Catherine during a 10-minute session on how businesses can proactively encourage inclusion and the opportunity this brings for workplace health and wellbeing. And then finally, it'll be over to Helen Hale, EMEA Head of HR at Citi. We're delighted Helen is here with us today, and she brings a wealth of experience from her 20 years at Citi in various HR roles, and she'll spend about 10 minutes sharing how Citi approach health and wellbeing inclusion, including the benefits that this can bring. And then as ever, we'll open up to your questions and we'll try and make sure we answer as many of those as we can. So without further ado, let's get started. Naveen, welcome and over to you.
That's great. Thank you very much, Mark. Thank you for the introduction and thank you for the opportunity to speak to your audience today. So, as Mark mentioned, my name is Naveen Puri. I'm one of the Associate Clinical Directors within Bupa. I come at this with a very clinical lens, and so let me provide some insights that will hopefully be of use and of help to you as employers, managers and leaders out there. We've coined a term called Everybody Health for this particular talk. And the reason for this is quite often I would be a panelist on a female health talk or a women's health talk and have the women at the end in Q&A sessions often say, wouldn't it be great if my male manager, my male partner, etc., were on this call? I've had the same with male health talks as well, where individuals will say, wouldn't it be great if my girlfriend, my mother, my daughter was able to hear what it is like to be a man and some of the challenges that we face. And equally, I've been to events for LGBTQIA plus individuals, or often they're not sure which talk to attend. Should they go to the male health talk? Should they go to the female health talk? Will the talk be too heterosexually focused? And so I think the term Everybody Health is a nice one that encapsulates that sheer diversity of consideration for all of us. We don't need to know everything about each other's health, but I think as leaders and managers in particular, it is important that we have some insights that afford us some knowledge of what people around us, our colleagues, our friends, our family are going through. So in terms of health and wellbeing and inclusion, then, we can look at this through a number of different lenses. And if we consider the Equalities Act, for example, there are 7 defined criteria within which we could look at this from: age, disability, sex, gender reassignment, sexual orientation, race, and also faith as well, being some of them. But there are many things that make us diverse, including our socioeconomic status, the school we went to, our education. And so what I'm going to focus on today, just to give us a flavour of the kind of considerations in the D&I space, is specifically around sex and gender identity. But please be assured that there are many other considerations in other realms, and while we won't cover this in today's conversation, these are things that we collectively should be considering. And so if we move on to the next slide, what I want to encourage us all to have is a always on approach. If we're looking for opportunities to be diverse and inclusive, we will seek them out. Whereas if we're oblivious to the fact that diversity and inclusion is important for a number of reasons, which hopefully you're all attuned to, then we miss out on the gains that can be made there. So the talk today will look at things from 3 perspectives. We'll look at the life course of all your employees and things that they may encounter as they move across those. We'll look specifically at cancer screening and how that plays out amongst different employee groups. And finally, we'll look at considerations around developing and moving forward with inclusive workplaces in healthcare as well. So on to my next slide. This part of the presentation is called Changing Bodies, Changing Health Needs. And I want to start off by emphasizing perhaps one of the most seismic changes that occurs for all of us early in life. Thankfully, all of us have now gone through this, but this is just an example of a change that occurs for all individuals and something which we can perhaps all use as a barometer for changes that occur for other people at other times, and that is puberty. Puberty is when you mature sexually, you develop your level of sexual attraction, so it may be same-sex attraction or opposite-sex attraction. And I want to emphasize puberty also from the lens of a transgender individual, because for transgender people, actually puberty can be quite devastating. It can be where their body undergoes changes that they can spend a lifetime having to undo. And so bear in mind that puberty is a big change for all of us, one that we can all readily identify with having experienced it. And so perhaps that can be a blueprint for us to consider other life changes that occur for people around us as we move through life. Secondly, then, I want to look at periods. I think periods are one of those things that often are not spoken about, or rather half your workforce will speak about them amongst themselves, and the other half perhaps ignore periods or are oblivious to the impact of them. We know that periods start for women and girls as young as the age of 13 and can take up to the age of 51 to stop. And so most women will have somewhere in the region of about 400 periods in their lifetime. Consider that, 400 periods where every month a woman is going through a cyclical process that affects not just her physically, but also psychologically as well, and therefore impacts her in the workplace too. I want to introduce a concept of period poverty as well. Alongside having regular menstrual periods, women have to spend a significant outlay, not just monthly, but over the course of an entire lifetime on things like sanitary protection, towels, new clothing, etc. And so when you consider that half of your workforce has an expense that the other half hasn't even got to think of, there is something to be thought of there. Let's then look at our male counterparts and colleagues. If you consider the concept of the andropause, or more commonly known as the male menopause, let me introduce what this is for those that are not familiar. The masculinizing hormone is testosterone, and this is something which gives us things like muscle mass. It leads to male hair development. It leads to men like me losing their hair as well. But it also is implicated in things like drive, aggression, and by aggression I mean positive aggression, such as drive and things of that nature. And we know that testosterone levels start to decline from about the the age of 30, and certainly by 40, a man's testosterone levels are declining by about 1% every year. The reason this is significant is that the change for men, the andropause or the male menopause, is much more therefore a gradual process rather than the female menopause, which is much more of an abrupt one, and we'll come to that in a moment. But we know that andropause, because it is so much more gradual, is probably affecting a large proportion of your workforce at this time. I'd also like to touch on a topic which is very rarely spoken about in forums like this. And on to the next slide. This is erectile dysfunction or issues with erections. I think men are very reticent to speak of this because of shame, embarrassment, stigma, a whole host of reasons. But I want to share with you as a doctor, this is a conversation that men come to me with several times a week. And I've got a statistic here which really helps highlight the problem. We know that 43% of men between 18 and 60 are suffering from some degree of erectile dysfunction or ED. Broadly speaking, I would put this into two camps. ED can be physical, so it could be implicated in things like high blood pressure, diabetes, anything which might affect your blood vessels. But also ED more commonly is psychological. So it can be because of one-off events like a stressful work meeting or an exam, or it can be because of more significant stressors like grief, loss, lack of promotion, and then background health conditions like anxiety and depression can also present with erectile dysfunction too. Why is this important? Well, not only is it important for the well-being of the men that are affected by this, but it can also have impacts on relationships, intimacy, and connection. And so I think by flagging this as an issue, and for one view to be aware of, is important. And then finally, I'll speak of the change that I mentioned for women, menopause, which I think is perhaps the most seismic change that any person in your workforce will undergo from a medical perspective and a biological perspective as well. When I spoke of puberty earlier, the reason I mentioned that is that because we all go through a puberty, whereas only women will go through a menopause. But I would like for the men to recognize that puberty, rather menopause, is as seismic and as consequential as menopause is too. I think a lot is ignored around menopause, but the fact is women have been living with this and contending with this, you know, for all the time that they've been in the workplace. And I think it's about time that we have caught up with this now. And I do see that there is more and more of a spotlight being shone on this. We know that 1 in 4 menopausal women will consider leaving work because of negative experiences experienced at work and in the workplace. And so given that this does affect many, many people and has such a profound impact on women at a stage in their careers where actually they're really useful assets to your firm and businesses, they will have a lot of experience, a lot of inbuilt knowledge around how your workplaces work. To lose them because of menopause, I think, is a real tragedy. So considerations around menopause are important as well. So I'll move on next then to looking at cancer screening specifically. We've looked at some very broad themes there around what can occur during the life course for your employees. And I want to focus now specifically on what proactive action employers and employees can take around health and well-being. And let's focus here on cancer screening in particular. With female cancer screening then, we know that there are formal screening programs within the UK that allow for women to be medicalised, for want of a better term. Women will have regular cervical HPV screens, or what are more commonly known as pap smears, every 3 years from the age of 25 up to 64. It's 5-yearly from 50 onwards, in fact, but it's a regular procedure nonetheless. Similarly, women will also be invited by a national government screening programme for breast cancer screening via mammograms from the age of 50 every 5-yearly as well. Despite those very formal programs being in place there, we know that there are many women that don't take these things up. So we know that 1 in 4 women, for example, do not take up cervical screening each year that they're entitled to. That amounts to about 1.2 million women, which is a real shame. And the pandemic has had a real impact here as well. We know that last year, for example, 1 million women did not have their mammograms because of the pandemic and factors surrounding that too. So screening is available for everyone. It's available on the National Health Service. It certainly is available in the private sector too, but we need people to come to their doctors to take those opportunities up. If we move on to male cancer screening, then this is a little less formalized because there are not medical procedures per se that need to be done, or an investigation that has to be done like a cervical smear or a mammogram. However, it is important that men are aware that there are screening procedures for them to undertake as well. I would like for all men to know that testicular screening should be done every month from their late teens and early 20s onwards, because the testicle never stops producing sperm, and so as a sperm factory, which is active all the time, it needs to be examined for the development of possible cancerous cells. We also recognise that men should undergo prostate screening when the time comes and is appropriate as well. And that's often in the late 40s onwards, the early 50s, etc. And so if men attend for routine health assessments, these things can opportunistically be asked of them. But because men are not medicalized in the same way that women are for cervical smears and mammograms, they seldom see their doctors unless they are very unwell, and therefore those conversations can't often be had. I want to flag that testicular cancer, it peaks in men in their 20s and 30s. So a lot of the men in your workforce will be in that age bracket. And there are still over 2,000 new diagnoses of testicular cancer every year, which is 2,000 too many from my perspective, because it really is a very easy cancer to detect if you're examining for it, and therefore one that we could prevent. I also want to flag the huge burden of prostate cancer as well. So we know that 1 in 6 UK men are affected by prostate cancer, and that rises further for men of Black African or Black Caribbean descent, either through descent or heritage, to 1 in 4. So it is important that men recognise that cancer can affect them too, and just because they've not been called in for regular screening, because there aren't formal screening programs for these cancers, doesn't mean they shouldn't be attuned and raising questions if they have any symptoms. And then finally, I'll move on to a consideration around trans cancer screening as well. And this is a really interesting area, because when you consider the organs that we screen for cancers, such as cervixes and prostates and such like, these are often the organs that for a trans individual are the source of their dysphoria and a source of real discomfort as a result. And so often they can be a sort of head in the sand approach and not looking to take up screening opportunities available to them. When we look at trans versus cis uptake of cancer screening, it is pretty poor. A statistic there cites that breast cancer screening amongst cisgendered women is about 65%, 2/3, already a very low figure from my perspective. But amongst trans women, or trans individuals rather, who are entitled to breast cancer screening, it's even lower at just a third, at 33%. As doctors, we take a very organ-specific approach. So we have no concern or care around how people identify. We celebrate all identities and diverse patient cohorts. But we do take a very organ-specific approach to help us navigate what test would be appropriate for what individual. And this is something we do with sensitivity and with an increased awareness as well amongst the public. So this segues in nicely to the final part of my presentation, which is around inclusivity in health services. We know that as the healthcare landscape changes, as Mark alluded to earlier, so does the approach that we take to the patients that we serve. Rather than a one-size-fits-all approach, we recognise that people's health needs are unique and individual to them. If looked at through the lens of the very broad diversity categorizations that we spoke of earlier, but also through other things like personal choices and lifestyle, etc. as well. So we need to make sure that our services reflect our service users. A train of thought in medicine right now is that heteronormativity and cisnormativity is not particularly inclusive and isn't necessarily serving us. And so to the point that I made earlier around having an always-on approach, I think if we consider that not everybody is heterosexual, not everybody is cisgendered, then actually a doctor will have in their mind, or a clinician will have in their mind, that there may be other health needs out there. And I think if we apply this across the board in diversity and inclusion, by recognizing that not everybody fits a mold that we're familiar with, their needs can therefore be met. And then finally, any talk on health and diversity and inclusion would not be complete without a mention around mental health and psychological well-being, particularly as we sort of emerge from the pandemic in the baby steps that we are. This is obviously a huge area of specialty, and I think from Bupa's perspective, at the very least, we are now providing much more parity between physical and mental health, recognizing that actually there is a real mind-body connection, and poor mental health can lead to many physical outcomes that are poor and adverse. If we look at the LGBTQIA+ population, some of the mental health needs there are pretty specific and unique. Issues around shame, fear, the violence that they can experience just by living their lives as they do, and also the lack of understanding on the part of society as well. And I think for the rest of us that want to be of use to those individuals, considering how we show up and present as allies can be really significant there. For men, there are real expectations and societal sort of constructs around what it means to be a man, and sort of men not being able to speak of their feelings, or men don't cry. There is this fear of a vulnerability, which means that men's mental health is really affected. This is why we have movements like Movember to address the very high rates of suicide amongst men. And do consider the mental health needs of your workforce who may be men, because it is something which is still very taboo and not spoken about. And then finally, for women, women take on so much in terms of domestic responsibility and societal expectation and burden. It is really quite staggering that they manage to do all they do as women within modern societies, plus also work in the workplace and do the amazing things they do as professionals too. The pandemic, again, really illustrated the burden on women. Many people who took on the responsibility for homeschooling were mothers and women. And so we need to recognize that there is this real mismatch between what we espouse in terms of equity, but actually what happens in reality. I also want to speak of invisibility for women as well. This is something which, I as a man will never have to contend with potentially, but throughout a professional course, women will often be, sidelined because of a man taking up an opportunity before them. And certainly as women become older, around menopause and upwards, there can be a real invisibility which women often speak of. So do you consider that from your perspective as well? The last point I want to introduce then is around a concept of intersectionality and minority stress. Two rather big words, and let me try and break these down for you. Intersectionality is a theory that people are multiple intersecting parts of the pie chart, if you like, and parts of multiple identity, whereby there are lots of things that can doubly or confound their disadvantage. So, for example, the theory was developed by somebody called Kimberly Crenshaw, a black feminist, who recognized that not only was she a woman and therefore disadvantaged in the way that women are in society, but also she was black and therefore disadvantaged in some of the ways that people of race are as well. And so intersectionality is an important consideration. You may have, for example, an employee who is disabled and transgender. There will be intersecting needs there which are unique to them, and so this one size fits all approach doesn't work there. Rather, an individualized one is much more important. And finally, the concept of minority stress. Being a minority within a minority can in itself be very stressful, and so to be mindful amongst your workforce, there will be some people who contend with that every single day of their lives, and to be mindful of that can be really helpful as well. Thank you.
Thank you, Naveen. Wow, I think you've just broken a record for the most educational update in such a short period of time. That was absolutely phenomenal. And I'm sure I'm not alone in saying I've learned an enormous amount just in that 10 minutes. I also love that term of, I think you used the term, the medical term of organ-specific approach. And I love that. I think there's something in that for, imagine if the whole world just looked at things with an organ-specific approach, wouldn't we be able to make a difference?
Wouldn't it make a huge difference?
Yeah, so no, thank you so much. I really enjoyed that. Now moving on to our next session. So I'm going to introduce Catherine onto screen now. But before I get into the session with Catherine, we are going to open up, as ever, a poll that you'll see appear on your screen as well. So it would be great to understand your views on your comfort level when talking about EDI. So please complete the poll and we'll come back to that in a second. So Catherine, we're going to have a chat about how businesses can proactively encourage inclusion and the benefits that this can bring to health and wellbeing in the workplace. So thank you so much for joining us. Welcome to our Health Insights live call. I think it's your debut with us today, but having just seen Naveen in action, you get the drill and you get what we're trying to do here. So let's crack on with my first question for you. So equity, diversity and inclusion, it's a massive topic, both from how I introduce things, from what Naveen said. I know you're massively passionate about it, and I know you're particularly passionate about this idea of conscious inclusion. I wondered if you could just bring that to life for us.
Yeah, sure. And thanks for having me. So I think it'd just be great actually to start with what some of the words mean, because I think EDI quite often get talked about together and it's helpful just to break those down a little bit. So one of the analogies that I refer to that people listening may have heard of before is that diversity is the party. So it's who is invited, who's on the guest list, who's the mix. Inclusion is then who is invited to dance at the party and who's actually involved in having a good time and not kind of left around the edges. And then belonging is being able to dance like nobody is watching, or choose the music that you want to dance to, or say, do you know what, I'm having a really good time and don't feel like dancing today, and nobody gives you a hard time for it. So diversity is a fact, inclusion is a choice, and belonging is a feeling. And then the other couple of words that I think is just beneficial to explain how I talk through the differences is the concepts of equality and equity. So I think they quite often get mixed up with, I love the language that's been talked about so far in the session around one size fits all. So equality is really about treating everyone the same. So if you picture three people of different heights trying to see over a fence, it's only the tallest person that can see over a fence. You go and give them little platforms to stand on so that they can see over the fence, and it might be that still only the tallest person can see over the fence because the platforms aren't big enough for the shortest person or the person that's, you know, average height in the middle there. So if you move to equity, then it's about giving people the stools that they need to see over the fence. So the tallest person can keep the one that they've got because it's working adequately for them. The shortest person needs a slightly higher platform, and the person in the middle needs something in between so they can all see over the fence. And that's ultimately this idea of equity and giving people what they need. Inclusion ultimately is taking down the fence so that you don't need to drop a solution in at all. And then just to come kind of full circle to your question around conscious inclusion, I think quite often, you know, there's lots of conversation and debate and awareness around unconscious bias. The reality is we all have it. You know, our brains are these incredible machines making decisions quickly all the time based on our own experiences and who we know and what we trust and what we've tried before. But actually, if we can think about conscious inclusion, which tends to be the slower, more measured, you know, goes and seeks research feedback parts of our brain. It's this idea, I've actually got this quote on my desktop, that unless you're consciously including people, you are probably accidentally excluding people. So if you think about overrepresented populations and underrepresented populations in your workplace, you know, are the underrepresented groups getting as good a service or as good a access to healthcare as your overrepresented groups?
Great, thank you for that. And again, you know, plenty more for people to get their heads around and comprehend, I think, on this topic. I think we're going to have the poll results. Certainly I've been sent them, so I don't know if we can share those. Let's see if they come up. If they don't, we'll go on to the second question. Maybe we're not going to show them. I can tell you what the poll results are. I'm delighted to say actually that the highest scoring answer was that people are genuinely proud of their company's progress so far. 38% of people said that, so we're clearly making a difference. Low answers, very low answer actually about people worried about getting it wrong. I probably expected to see that higher, only 12% of people, low proportion, 18% saying it feels like a tick box exercise. But I think the thing that's probably really pertinent for us today is 31% of people said they'd like to feel more confident talking about the topic. And, you know, as we've seen already, there's an enormous amount to take on board and get our heads around. But half the battle here, I think, is getting people to feel more comfortable and just get those conversations started. So good to see that on the poll. On that topic then, Catherine, these conversations that we're having, particularly from a health and wellbeing perspective, you know, they can be areas, and we've probably all seen lots of words on the screen that maybe when we were a kid, we might have been like, you know, in the classes at school, and taboo topics that, you know, it's tricky for people to have that confidence. And great to see that we're making some progress on it, but clearly there's more work to do. You know, how can leaders kind of face into that and just be brave?
Yeah, great question. I think you know, fear's an interesting one because I think it does get in the way a little bit. And in terms of confidence, I think the biggest thing we can all do is recognise that none of us will ever be fully kind of confident talking about all aspects because we've all only each lived our lives. So one of the things that's really important in terms of in the workplace, if you've got kind of networks or colleague forums or communities or something else, if you've got groups of people who are kind of passionate people that have got together that are really representative of your workforce but also broader society, then the real key here, I think, is getting to know people who aren't just like you. So whether that's in the workplace or beyond, you know, looking at the movies you watch or the books you read or people that you follow on social media even, you know, making sure you've got a mix of influence. I know I'm very guilty slightly earlier in my career of going to my usual go-to people, and I recognise that those people, whilst giving me valuable feedback, were all a bit like me. So extending my circle of influence and who I learn from is something that really resonated for me, and I'd recommend that for anybody listening. And then I think this idea of, you know, as leaders, if you're making decisions that affect people, build with, don't build for. So again, if you go back to this one size fits all thing at the beginning, so many of our policies, our processes, our systems, our research, our marketing, were designed, for organisations that have got a long legacy with this kind of one size fits all concept. And the reality, which is, I'm loving this conversation today, is much more about what does the individual need? What does the human need to be healthy? What does the individual need to be successful at work? And, is our offering, are we being really consciously inclusive when we're thinking about any decisions that involve people? So collaboration's key here, really, and really listening to and going out and seeking perspectives from people that are perhaps outside your immediate kind of regular circles. If you have Monday morning meetings and it's always the same people on the Zoom, or it's always the same people in the room, go and proactively seek out alternative perspectives beyond that too.
Yeah, great answer. And I think I couldn't emphasize that piece enough about going and seeking out that other perspective. I think I know from experience, I remember a conversation with a lady who'd come back from maternity leave with me, not thinking it was a big deal. And she just started talking to me about what it was actually like for her. And it was like, oh, wow, I had no idea that was what it felt like. And often this is about how people feel rather than just what you can observe or books that you can read, where you just get an understanding of what it's like to be in someone else's shoes. And a lot of this, I think, is about empathy and that ability to put yourself in that position. From a health and wellbeing perspective specifically, and the kinds of things that Naveen's talked about there, how does inclusive health and wellbeing, do you think, help make workplaces more inclusive?
I think it's like anything. It's like, if colleagues have got access to a portal, for example, and they log in and they can see male cancer screening, female cancer screening, trans cancer screening, that's a point of raising awareness and reducing stigma for people, just really kind of passively on a perhaps digital screen or a platform or a mobile device or whatever. I also think, in terms of internal kind of storytelling, and just like you said, actually, people sharing their own experiences if they want to and if it's appropriate and in the right forums is really powerful. And I just think, we've talked about this a lot today, which is great, but, healthcare needs are individual. And actually that organ-centred approach really works because it's, if you make it human focused rather than product focused, then actually it's about getting the individual the support and the access to the healthcare that they need. So I think employers just have a really great role to play in this space. And obviously, Bupa are making significant influence as well in terms of helping employers with their kind of products and their services, but also the employees' experiences. So again, if you're logging onto platforms and you're seeing support for menopause or erectile dysfunction or whatever that may be, is kind of doing this constant drumbeat of reducing stigma, raising awareness for everyone, but importantly, kind of treating all your colleagues with the kind of, just the kind of dignity of being a human being that's going to need different things at different stages of their lives.
Completely. Again, couldn't agree more. So let's imagine we've got all these people on the audience, in the audience, Catherine. Some people will be well on the road to this. Some people will be like, oh, I really need to do more. So everybody walks out of the room after today and thinks, right, I want to make a difference. What would your advice be to people who decide hopefully on the back of the intervention we've made today, that they want to be even more proactively inclusive? What should they go out and do straight away?
So I talk about 5 things anybody at any level in any organisation can do. And my recommendation is pick one. And then when you've kind of feel confident about that, move on to the next one. So I'll just walk you through those quickly. So the first one is whenever you're making a decision about people, make sure there is a mix. So go back to that party analogy at the beginning, who gets invited? The second one then is if you've got the mix, make sure, the psychological safety is there for every voice to be heard and people can speak up and offer an alternative perspective or a different point of view. It isn't just the people who've been there the longest or the people that are the most senior that hold the airspace. Make sure that you're kind of managing that so that you can hear from different people around the room. The third one then, I've alluded to this already, but, widen your sphere of go-to people, deliberately go out and seek alternative perspectives. I really can't underestimate that one at all. It really does just extend your awareness and always highlight something that you've just perhaps not considered before. So that's really important. The fourth one is then just, you can do this in a mechanical way through things like engagement surveys, or you can just do it in one-on-one conversations or team meetings. But what can you do as a leader to help people to feel more included? So if you know that there's somebody in your team that's brilliant, has got some great thinking, done some great research, got some great ideas about something, but perhaps doesn't feel comfortable to speak up in front of a group, is there something you can do differently to make that a reality? It might be sharing the agenda in advance, for example, rather than putting somebody on the spot in the moment. And then the fifth one, again, I've talked about this before, but get to know people who aren't just like you. So whether that's in the workplace in terms of attending internal events, many employers will be putting on, network events, whether it's for National Inclusion Week or Black History Month or Pride or, any of those kind of key moments in the calendar. But also just personally, when you're sitting on the sofa or you're going for a walk or you're in the car or you're reading a book, really have a look. If you've got a bookshelf, audit your bookshelf. Are all the authors, do they look a bit like you? Change it up. If you really like movies, have a look at who the directors and the writers are. If they're all a bit like you, change it up. And similarly, your social media feeds and your podcast and all that kind of thing, just look at who your current sphere of influence is. And if they're all a bit like you, change it up for that wider perspective, just in your everyday kind of interactions and experience as a human being. You'll find you've actually got a lot more in common with people than you think.
We've all got organs. That's what I've learned today already, right? That's something we've all got in common. I think I definitely get this theme coming through everything you've said, Catherine, about consciousness. Even down to, I was reflecting as you were talking about, every one of us as a leader, perhaps with responsibility for people, especially after doing it for years, you just fall into some very unconscious habits and actually asking yourself to hang on a minute, have I fallen into some habits which are uninclusive? And what can I do to be way more conscious about the way I create that environment? And you can straight away almost feel the difference that would make just by imagining that compared to, the boss hogging the limelight or whatever. So brilliant. And I think a great blend with what Naveen's talked about to see kind of different elements of this. So thank you so much for your input there. You're going to stay with us, as is Naveen, for our Q&A in a while. But we're now going to go over to our third speaker today. So Helen Hale, welcome, Helen. Delighted to have you join us today. And you're going to share a bit with us about how Citi are approaching health inclusion. So I think we're all looking forward to hearing the examples that you've got around how you create that positive and inclusive culture that really does support wellbeing for everyone. So over to you, Helen.
Great, thank you very much, Mark, and thanks to Naveen and Catherine, really insightful, and I've learned a lot already this morning as well, so great to hear you both speak. I would like to share a little bit about some of the work we've been doing at Citi. Citi is in of itself a very diverse organisation on some components, a global organisation, 220,000 employees, 100 countries. And in the region that I look after in EMEA, we're 30,000 employees in 55 countries. So already, we're trying to cater for individual health needs, as Catherine pointed out. This is a very individual to individual employees, on a pretty big scale. So we're always trying to balance that one size fits all and consistency with the individual needs of our employees. So that's a challenge we face and will continue to face. Having looked at the poll results, I feel very similarly to the audience I'm really proud of the progress that Citi's been able to make in the EDI space. But equally, it doesn't absolve me from also feeling like, sometimes you do feel a bit uncomfortable and you're not sure how to talk about things. So, that happens to us all. Even somebody who's, been in HR 21 years like myself at Citi, I've just had my 21st birthday. We all feel that way. But yeah, let me just dive into maybe some of the examples that I can share and hopefully tying into things, topics that Naveen and Catherine have covered as well. So on the slide here, without this wanting to be a show and tell, look how fabulous Citi is, I really want to sort of get into some of the things that have really made a difference, in my opinion. We do try and use a range of providers to support us in our benefit space and allow us a little bit of that flexibility to tailor our offering to individual employee needs. So I think, you know, that's one way that we do think about that in terms of diversity of suppliers, for want of a better description. Bupa is, of course, one of our key partners for healthcare, and they support, you know, us in our wellbeing agenda. And this first item on the slide around Flourish and manager training really was born out of the pandemic. And the feedback that we were getting from employees around how they were feeling, the pressures at home, working from home, always being on, never feeling off, you know, the blending of work and home life that we've all experienced. So we, in partnership with Bupa, and this is an example of something that we ran across EMEA really rolled out to all of our employees in the region. And it was focused on modules around emotional, physical and social, financial well-being, you know, issues that really sort of came to the fore in the pandemic, some of which were probably there, you know, pre-pandemic, I'm sure. And we've really tried to address the needs that we were hearing from our employees through, you know, surveys that we were doing as we moved to a, you know, working from home environment. And this has been so successful that we're actually scaling it globally. So it's a great example of, we started in the UK, we then scaled it up to EMEA, and then we have scaled it up to our global organisation. And over 1,000 of our managers have attended a workshop in wellbeing to help them better support both themselves and their teams. And we talked about the impact that leaders and managers can have. And that was a really important component of that for us. Whilst we were trying to support all of our employees, there was a particular component that was quite specific to managers that we felt they have a unique role to play in caring for themselves and for those that are in their teams. And that is probably the point in that I'd call out specifically. Moving on to mental health more generally, you know, we would like to think in Citi we've done our part to pave the way for the financial services industry to bring some parity between our physical employee support and mental health and mental well-being, which I think has taken some time to catch up with the physical side of our healthcare provision. We started this journey in 2016 with a Minds at Citi partnership. And one of the practical things that I'd really call out, and Catherine mentioned it, what I think has made the biggest difference in this is having senior leaders openly share their own personal mental health stories. I think that point about storytelling is so powerful. And we've seen this not only in the mental health space, but also as we think about some of the aftermath of the Black Lives Matter movement. And in Citi, we had some of the most powerful and most poignant moments with senior leaders sharing their stories in both of those spaces that have pushed us on in a way that wouldn't have happened, I think, if we didn't have that storytelling component to some of these campaigns. We took a decision to remove some of the limits of our, you know, outpatient mental health claims in 2019. You know, again, a different, much more about policy and offering, so a different take on the same thing, but basically trying to, release the power of some of these tools that we have, and make sure that they're accessible to everyone. We've also talked about that as a theme. We've also been providing on-site and remote service to employees, obviously through the pandemic, of mental well-being practitioners. alongside our existing employee assistance programme service, which again is available to all of EMEA. And that's something that I also tell a story on myself in terms of, I think it's really important as a, the senior person in HR to say, I've used that service when I was having a difficult time and it made such a difference to me. I think you can't, it's one thing saying there's an offering, it's another thing saying I've used it and it's okay, and we all experience difficult times. So I've found that for my own organisation in HR, but just broadly across the organisation, permissioning and normalising, and it's okay. We're also seeing some effects of the pandemic as we think about our return to the office, anxieties of employees around returning to the office and what's that going to mean for them. So we've also introduced mindful wellbeing support to really help specifically with some of those particular anxieties, making that transition back from constantly working from home. This is an ever-evolving sphere, and so the next box on the slide, UK wellbeing audit, it's sort of you can almost never keep up in this space, and it was talked about earlier in terms of having a proactive approach, and we really sort of try to do that. We're a big organisation, so I would have to say we're not always perhaps as proactive as we'd like to be, because sometimes things just take time to work through our large organisation. But we're embarking on another full review of our UK benefits provision and providers to really inform our 2022 strategy. And I think that's something it is a constant effort, and thankfully for me, I've got a really passionate team who want to be at the forefront and really want to sort of drive this agenda. That isn't, though, something that we can only do in HR. And moving on to thinking about employee networks, and Catherine, touched on this also. How do you engage a broader population? This can't be about us creating at the centre in HR and then sort of pushing those ideas out. It's how do you get from your employee base a real sense of what their needs are and how those needs might differ and how we can cater for those differing needs. We've had employee networks at Citi really since 2002, and we're already up to 218 employee networks across EMEA, covering disability, pride, women, families, roots, salutes, and generational differences. So, I think this is a space we've been in a long time. Naveen mentioned intersectionality, and that's something that we're really focused on in terms of there could also be lots of employees who belong to many of those groups and maybe even all in some cases. So really trying to make sure, as well as having the individual networks, they connect with each other for those intersectionality opportunities. So we've had these groups for a long time, and we certainly leverage them in terms of thinking about our well-being and health offering and getting their inputs as we try and sort of design and develop and evolve that. It brought to my mind when Catherine was speaking earlier about employee networks, about connecting with people outside of your immediate circle and ways to do that. And Naveen mentioned allyship, and that's definitely something that we leverage a lot at Citi. Also reverse mentoring. I've just been matched with my mentor from our LGBT Pride network, who we're going to have a reverse mentoring relationship. And again, I think that's really important for senior people in an organisation to be mentored by our colleagues from probably a different generation and who have other differences to us, so we can really see all of those unique perspectives and bring those to bear. In terms of private medical insurance, the only thing I wanted to mention here, I just wanted to pick up the point, and Naveen covered menopause in his presentation. That is something that we're also really, thinking about, and how do we support that in a more obvious and overt way, thinking about the mention of the portal and what do you see on there and what's available to employees. We really try and make sure our PMI is inclusive and it's a package that supports everybody. We offer full gender dysphoria is covered, and we've had really positive feedback on that benefit, not just from those who've used it, but in general from the employee population, demonstrating that sort of recognition of, we're really trying to be, as broadly inclusive as we can. We've got health assessments on here, and actually preparing for this presentation, I was thinking, gosh, I need to get my mind sorted. But obviously, really having those to make sure our employees feel that they can, early identification or any potential future health risk is available to all employees, and can really also be tailored with follow-up appointments based on age, gender and specific needs. Again, coming back to the tailoring. So, you have your assessment, but then we can tailor that further to, really sort of hone in on the specifics for you. And lastly, Citi and the Paralympians, something that I'm really proud of is Citi's partnership with the Paralympians and the Tokyo Games. It was amazing to see around the organisation that how this galvanised our employees around watching the success of the Team Citi, which we call it, the Paralympians that Citi supports. Not just about the medals that they won, and there were many, but really just demonstrating the support for excellence and achievement, and really profiling those Paralympians, I think was really important for our employees to see, and particularly those who perhaps have a disability themselves. So just to finish with a couple of upcoming focus areas, as I've said, this is ever evolving. It is around menopause support is one of the big areas that we're looking at the moment. And, as well as just our culture overall, the sort of headline here is promoting a culture of health. But, we have to, that is embedded in a culture of inclusivity, and one where, we're transparent and accountable and excellence and all of the other things that Citi stand for. So, evolving our culture is also something that never stops. So thank you.
Thank you, Helen. That was great to hear. I love the blend of things you've got going on there, from policies and practices, employee benefits provision, training, culture, sponsorship. I think there's a real lesson in there that this is a whole package of and a whole strategy, rather than just something where you've ticked a box in your PMI policy or you've changed your policies and practices. So I think it's great to see that brought to life with the fantastic work you're doing. So we're going to go to questions now, but I'm going to go to you first, actually, Helen, because you mentioned something about reverse mentoring, and for me that's always been a very obvious place you can go. Right, and easy, and then we all learn more. But one of the risks, and I think there's a TED talk on this actually about reverse mentoring, is someone like me reverse mentors somebody with the intent of me learning, and within 5 minutes, I'm passing on all my expertise and knowledge, and actually it has completely the opposite effect. What are you doing to make sure something like that, which is really real about culture? How are you going to make sure, how do you make sure that's a real success, rather than maybe reinforcing things that are already in place?
Yeah, it's a super question, Mark, and actually making me think. I haven't had my first session with my mentor yet, but I've really got to. It's definitely one of those things where I think long and hard about. I'm going to need to, really be very conscious, picking up from what Catherine said, in that mentor-mentee relationship, to not fall into those habits, because, you know, I do a lot of mentoring as well. You know, I'm being mentored here and I need to sort of remember that. So I don't think there's any, you know, very elaborate answer I can give here, other than being really conscious, understanding your role in that relationship, and really permissioning the mentor to be your mentor. I think that's the other thing that I want to make sure I do as I approach that, is really making sure that they feel empowered to mentor me.
Catherine, I don't know, I can see your face behind the scenes, and I just get a sense maybe you might have a view on this, because I think it's quite an important topic that you could follow.
I agree. It's such an easy trap to fall into. It's one of the ways to kind of elevate it further, if you like, is to make it two-way mentoring. So if somebody's taking their time to mentor you, what can you do for that person in return, and making it a 50-50? So that's kind of this idea of sponsorship. So who can I introduce you to? Perhaps you could attend a meeting that you wouldn't usually have opportunity to. Perhaps I can, you know, I hear about a vacancy in another team that you might not have had visibility of. Like, how can I actually kind of sponsor as well? So I don't think there's a hard and fast rule, to Helen's point, but I think it's the give and the get for me makes those relationships super powerful.
Great, and I will take an action from this today to go and see if I can find that TED talk, because it was great. It touched on exactly this topic, and hopefully if I can find it, we'll find a way of getting it circulated to attendees. Naveen, I'd like to come back to you. We've left you sat there for a little while. Obviously there are a wide spectrum of groups that you've talked about today, many of whom we'd have expected you to talk about, some of whom you wouldn't. I didn't expect you to refer to bald men today.
We had to get an inclusion.
When you think about post-COVID and a post-pandemic world, are there any groups that you're particularly concerned about, who maybe will come out of the world that we've been living through, having gone backwards and needing more attention?
Yeah, great question. I think there are several groups that come to mind immediately. I think in the press and the mainstream media, there was a huge amount of attention shown on the fact that people from certain ethnic minorities were disproportionately affected by COVID. And what we've come to learn as our thinking around this has evolved is that it wasn't necessarily, you know, having a brown gene or overactive melanin that predisposed you to worse outcomes with COVID, but rather people that are of ethnically rich backgrounds sometimes do live in multi-generational households, or do jobs that are public facing, or have lower socioeconomic status, which is another confounder. So the concept of intersectionality is really illustrated there very, very well. It wasn't just about being, say, Asian like me. It was about being Asian and perhaps socioeconomically deprived and living in a multi-generation household, for example, which was a factor. We also know that COVID affected people that had pre-existing comorbidities. So again, you know, your workforces will have all manner of conditions which they live with day to day. And it just takes a pandemic to come along to make somebody who otherwise functions really, really well to suddenly fall off kilter. So your diabetics, for example, may well have been more affected. People in your firms and teams who may have had cancers or are currently living with cancer could have been affected. Your pregnant employees would have had lots of considerations around how to navigate COVID, whether to have the vaccine, those sorts of things as well. So many, many people were affected. And I think it's a great illustration of how, you know, how a diversity of thinking really helps us to consider the needs of many, many people, from the obvious, you know, race or sexual orientation or gender categories to other things like socioeconomic status, pregnancy, the things that perhaps we consider less in the D&I landscape.
Great, thank you. I know I always say this, where I say we've got loads of questions, and I do genuinely mean it, but we really have got loads of questions today, and I know we're running out of time. So unfortunately, I've probably got one last question, which is going to go to Helen. Helen, not everyone wants to share their story out loud and go on screen and do webinars about how, you know, they dealt with their challenges or whatever. What do you do to support those people who are just quietly maybe suffering trauma or frustration or whatever it may be, where they've not been included?
So it's a really good question, and I think that my first reaction to that is that's okay, and allowing that. You know, not everybody does want to share. So I think it's not putting the pressure on to feel that you have to share in that way. but making sure there are avenues that they can be encouraged to, particularly if it's going to be beneficial for them to, talk to somebody or share the concerns that they have. And I think that's why, trying to offer, things that are more sort of one-on-one, whether that be on site or remote, and having things like an employee assistance program and permissioning to use that. Having managers who are able to, recognize signs or maybe notice that somebody's particularly quiet. We've also been thinking about, managers and their capability to be able to spot, things without also, making them feel that they need some professional qualifications to do so. So I think it's all of those things. And generally being an environment where you don't feel that you have to speak up if you don't want to, would be my thoughts.
Great, thank you. And thank you to all of our panelists today. It's been amazing, actually. I can't believe the hour's gone, and I've learned loads. I'm sure I speak for the audience in saying that I hope they have. I think my takeaway today is there's no doubt this is a really serious business issue, but it's also a really serious life issue. I think we talked about some things which genuinely could be life or death kind of situations, even down to deferring mammograms because of the pandemic. So it's something that impacts everyone. It doesn't matter whether we've touched on you today or whether you know somebody or your family or your partner or whatever. So I've loved the passion and drive, I think, today that's come from all of our speakers. And I think maybe if we can all harness a little bit of that and take it with that education that we've had and then commit to going and doing just something coming out of this today and going to start to continue to make a difference. Collectively, we really can make a difference to this. So thank you for joining us. Thank you again to our speakers. And we'll be back again in December, early December, where I think we'll be continuing this topic and probably really zoning in on mental health, which I think is an area that still has plenty of road to run in terms of things that we need to talk about. So thanks for joining us, and we'll see you again soon.